Thank you, Jeff and Melissa. You both did a phenomenal job today sharing this amazing grassroots movement. One of the words that really comes to mind when I think about this is peace of mind. And being an entrepreneur and a business owner for the last 20 years and having to pay for my own healthcare is an amazing, horrible thing to have to deal with, guys. We know that, independent contractors are screwed because you can go to the marketplace, but then you have to tell them how much you plan to make. And if you make even a penny more, you get all these fees. And then there's been times where you pay the high prices of these private groups. I call them the big bucas, right? Blue Cross, United. And then you're all of a sudden out of network with a child in an emergency situation, and they don't advocate to try to reprice or do anything for you. And so over the last 20 years, we have seen so many times where it's just been so frustrating. We've even gone without insurance. And some of you are trying to sneak along and think, I'm healthy, it's going to be fine. So when we made the partnership and became members of Impact, my husband and I did our due diligence, especially because we knew that if we liked it, we would share it with people. And it has been phenomenal. And like we heard from Jeff and Melissa, their savings were astronomical. Ours were too. We have a family of 5. I have 3 active boys. Our average healthcare was $2,000 to $2,200 a month with a $10,000 in network, $22,000 out of network. And with Impact, we were able to come down to $605 a month and only have a $2,500 family deductible. Now, things like our chiropractic visits, our wellness visits, any type of things we want to do to keep us healthy are applied to that deductible, which is fantastic. And you definitely need to read the guidelines like Melissa talked about. But I want to share something that happened because sometimes we think, I don't really need it. I'll wait one more month. Well, listen, you guys, I had an independent contractor friend of ours in Utah who has gone without for a while. And I am so grateful that he sat down and had a conversation with me. And we ran through how Impact could be a benefit. And he signed up for May 1st. Well, on May 4th, he was not sleeping. He did not feel good. He felt like he couldn't breathe. And they rushed to the hospital, and he ended up in the hospital for 6 days with some kind of infection that nearly took his life. And because he had Impact is why he even was willing to go to the hospital to get it checked out. And I think that that's the problem is a lot of times we heard from Melissa and Jeff, they didn't really go to the doctors either. Why go and spend money? But when you have an advocate like this, you actually go and get all of your tests. And if you're in your 40s, like I am and my husband, we really knew it was important to get those, exams to make sure we are healthy. We have high risk. And so I'm going to show you some things that came up because we had been members of Impact and I would not have gone to the doctors otherwise. So the first thing is I went to my normal wellness visit as a woman. So ladies, you can count your OBGYN visit as your annual visit. And because of that, we caught something that might have been a concern for my health and could be cancerous. And so then I went and started having all these screenings. Well, it turned out to be a lot worse than they thought. And luckily, during this time, I was like, nope, I'm healthy. It's going to be fine. But they kept sending me for more screenings to make sure. So I'm going to show you a repricing really quick to show you how much of an advocate they are. Sorry, we have kids getting graduated right now. So here's what happened. I ended up working with ProScan, and ProScan is a nationwide company. It was so simple, just like Jeff said. I walked in with my Impact card. They took it, my driver's license, scanned it, sent it over. Well, over these few weeks of screening and ultrasounds to make sure that we were cancer-free, it wasn't cheap. It came to $3,300. Now, everyone will say your health is worth the money. Well, what was so good about this is at this point, we were at our 10%. And so the group paid 90. And so not only did Impact do the reference-based pricing, which was phenomenal, they took a $3,300 bill and reduced it to $832. But because the members shared in that expense, we only had an expense of $83. Now, this is a big deal, you guys. Now, even if I hadn't met my PRA of $2,500, $832 is still better than $3,000. Would everyone agree with that? So you have to look at it like you want someone who's advocating for you. Let me give you another example. One of my really good friends, I talked to her and her husband came to Impact. Well, she had a traditional job, and for the same price it cost her to have healthcare, her husband and her future newborn baby could be part of Impact. Well, she just recently sent me this picture. She had had a baby back in July, and what was so incredible was it was a complicated pregnancy. And even though she picked a midwife, she did choose to be at a hospital, but the baby had a lot of stress. And all of a sudden they had to rush her to a different hospital 3 hours away. And so they helicoptered her over. And I will tell you that this is impressive because they were able to take these ambulance, quote, air ambulance bills of over $33,000, reduce them to $16,000. At that point, she had no PRA left with the delivery, emergency C-sections, all these things. And so they only had to pay $1,600 for this air flight situation. And I recently just worked with a business owner who was really afraid of this because he and his wife had been in an accident and she had been helicoptered, and they had a $65,000 bill that no one would help them reprice. And that was the cash paying price. So again, I just want to reiterate is there's three things that make this so great. One, it's privatized nonprofit. They're good fiduciaries of our money. They do the repricing, they put it down. Yes, there's a pre-existing clause, but it's not all or nothing. Number two, we're inclusive. We want to include everyone. As long as we're willing to share our burdens with our neighbors, that gives us the federal mandate to protect us if they ever put back fees. So it counts as healthcare that we need as independent contractors. And then to have an advocate who will do reference-based pricing. They will even reference-based price situations when they are not covered with pre-existing. I'm going to show one more bill so you can see this. I got permission from Impact to share this. Was a cancer patient. They thought they were cancer-free. And in the last few months of their 36 months of remission, they ended up in the hospital again. And Impact said, listen, we cannot share this bill. This is a pre-X. However, we're going to do everything we can. And they took a $223,000 bill and reduced it down to $14,000. Now, ladies and gentlemen, the whole idea here is to have an advocate and to stay healthy. The members of our group are looking for members who are generally healthy, who want to make it easier. And so I'm just glad I got to be a member testimonial and let everyone know that the whole idea here is to get good health coverage, to have an advocate for us, and it saves us time and energy. And I could give you hundreds of testimonials between the members that we have worked with to share this with, and all the different ways Impact's been an advocate. But it is just getting better and better. And I want to thank Jeff and Melissa for including me. And I